Welcome to the Osteophysio YouTube channel. As you can probably recognise, I'm not Louise. Louise is taking a break today, so I'm going to be talking about why am I getting pain in my heel. So one of the main reasons that people come to see us with pain in their heel is plantar fasciitis. Your plantar fascia is a thick connective tissue band that runs from the medial tubercle of the calcaneus through to the metatarsals. It is important for walking and for support of the arches of the foot. Despite having itis in the name, plantar fasciitis is not actually an inflammatory condition. There are no inflammatory cells in the tissue. In fact, it's considered now to be a degenerative or wear and tear type of condition. You can get micro trauma, micro tears in the plantar fascia. So the most telltale sign that someone has plantar fasciitis in the bottom of their foot is that they say the very first step when they get up in the morning is agony. They cannot put any weight through the heel of their foot. It's very, very painful. After a few steps, maybe 5 or 10 minutes, it starts to ease off a little bit. So some of the predisposing factors for plantar fasciitis include being a runner or suddenly picking up, increasing the amount of exercise you're doing, especially high impact exercises. Another factor could be being overweight. If you suddenly increase your body weight, that can put quite a strain through the plantar fascia there. It could also be a traumatic thing. If you've really strained through the arch of the foot, that can bring it on as well. So the way we manage this in clinic, and we come at it from a couple of different angles. First of all, we want to reduce the amount of load that's going through the heel of the foot. So this might be addressing any postural imbalances through the pelvis, any compensations that are happening due to hip, knee or lower back pain. For more chronic long-term conditions, the number one go-to gold standard therapy is shockwave therapy. So one of the other most common reasons that people come to see us with heel pain is an Achilles tendinopathy. Used to be known as a Achilles tendinitis, but like plantar fasciitis, there are no inflammatory cells in this tissue. Again, it's considered to be micro trauma, micro damage, wear and tear through the strong band of connective tissue, which is your Achilles tendon. The location of the pain tends to be a little bit more posterior, around the back of the heel rather than underneath the heel like plantar fascia, and it typically comes on again when people have suddenly increased the amount of exercise or change the type of exercise that they're doing. I had a lady in clinic last week. She came in, she was a grandmother, she'd been pushing her grandchild around in a pram up a hill, and she presented with this heel pain. So it's that sudden increase or change in the type of exercise that you're doing. So some of the signs and symptoms that might suggest that you have an Achilles tendinopathy are very painful and stiff calf muscles, and especially in the morning. So pain is generally going to be a bit worse in the morning. It eases off with a little bit of movement, but the more you use it, the more painful it's going to get. So any loading through the Achilles tendon is going to cause pain, typically stretching as well. So if you're going out walking and you're getting heel pain at the back of the heel, there's a very, very high chance that you've got Achilles tendinopathy. It happens usually unilaterally on one side, can often occur on the other side, perhaps at a later date. Much like plantar fasciitis, the way we deal with Achilles tendinopathy is to take the load off the tendon first of all. So this is going to be a lot of stretching through the calf muscles, through the gastrocnemius and the soleus. Also looking at any strain through the entire posterior chain of the leg. So looking at the lower back, the glutes, the hamstrings, all the way down the back, and having a look, is there excess strain going through these tissues which is culminating in Achilles tendinopathy. One of the other things that we do is even though it's not an inflammatory condition, we do often suggest icing the tissues. And in the long run, a long-term rehabilitation program is going to consist of eccentric loading. So loading through the tendon while the tendon is being stretched. So you can do this when you're standing on a step and lowering your feet down. It's the opposite from concentric when you're lifting up like that. If the symptoms persist or get worse and don't improve with more conservative approach, again, shockwave therapy is the absolute gold standard for Achilles tendinopathy. Typically, a treatment plan for shockwave might consist of about 4 to 6 treatments, and success rate is over 80%. And we do that alongside the other rehabilitation steps as well. So another reason that people may have pain in the back of their heel is a bone spur. It's far less common than plantar fasciitis and the Achilles tendinopathy, but can be equally disruptive to your day-to-day life and equally uncomfortable and painful as well. Typically we're looking for pain location, more specifically the anterior aspect of the Achilles tendon, just in behind the calcaneal bone. So the bone spurs form quite often due to increased loading through that area or degenerative changes. If the Achilles tendon has been overloaded as well, that can cause a bit of a bone spur in there. It can, as the bone spur grows posteriorly, as it grows backwards, it can start to dig into the Achilles tendon or irritate it on certain movements. It does present slightly differently to an Achilles tendinopathy. Usually if the heel pain is really not improving through all of the other treatment modalities that we've already talked about, then a scan would be indicated, and that would probably show the bone spur, either growing up into the Achilles or pushing backwards, irritating it from the front, along with the other soft tissue structures around there as well. To test this or to see the difference, what you can do is actually plantar flex your foot. So you're going to push your toes and your whole foot away. That's going to force the Achilles into the back of the heel, which may irritate it. That might be suggestive that you do have a bone spur that needs to be scanned and diagnosed that way. So another location that you can get a bone spur is underneath the arch of the foot, right at the back of the foot, sort of near where the plantar fascia attaches. This could be due to a bit of arthritis through the calcaneal metatarsal joints, causing a little bit of joint thickening, which is causing bone spurs to sort of push down into the plantar fascia, or due to increased strain through the plantar fascia, the medial tubercle of the calcaneus can start to push out and be very, very painful. It'll present very, very similarly to plantar fasciitis, and again probably needs to be scanned if your other symptoms are not improving.